I invite for the last talk, which is very important topic, the role of teleconsultation in endocrinology, the medical ethics, the legal implications and ethical aspects. And for this, I invite Dr. Prem Narayanan and Dr. Saket Kant.
Good evening, one and all. Fag end of the day, I'm sure. So we'll try to be short and sweet. And the topic is for us is on teleconsultation. The topic is on the teleconsultation in technology, and so yes, so this is the flow of our presentation. We'll be going to the definition of teleconsultation, followed by the modes of teleconsultation, then the guidelines, the advantages and disadvantages, and the legal aspects and the ethical issues.
So this is how we define telemedicine. It's a delivery of healthcare services. Distance is the critical factor. It has to be by healthcare professionals and using information communication technologies for diagnosis, treatment, prevention of disease, injuries, research or evaluation, and even for research and presentations. So it's been there for a long time. We've been using teleconsultation for a very long time. Patients do call you, telephonic consults are there. You even had Tele Diabetology. I had the fortune of using a telephonic ECG device way back in 1999, where it was being used at Scott's Heart Institute. What they used to do was, this device was to be provided to the patients. This device converts ECG electrical signals into sound energy, and this sound energy could be relayed over the telephone. That could be converted back into electrical energy and ECG. So that time also, way back in 1999, we could always transmit ECG over a telephone, and they could see and they could just tell us what is going on. So what are the various modes, Dr. Prem, of consultation telemedicine?
So just before going, is there anybody who has not done any teleconsult so far? In the small group, anybody who has not undergone any technical consultation so far? So I think everybody has done. So it's very important to know, because there are some advantages and disadvantages, and there are some areas which you need to be very careful. So the modes of consultation available, yes, the virtual face-to-face is available, then encounters via the computer, and or even the smartphone, then phone calls. I think that is in the Indian setting we get a lot of phone calls, isn't it, for asking for the medicines, or asking for the diagnosis, treatment aspects and all. And peer-to-peer e-consult also, that is also there, and that do not involve the patient directly. So
these are the types of teleconsultation that you can have. That depends on the mode of consultation. So on the mode of consultation, you can have a video consult, a audio consult, or a text-based consult. Now, timing of information is also important. That may be real time when you are talking to a patient on a video consult or an audio consult. It is a real time conversation that you are having, and you can provide real time consultation to that patient. But you can have asynchronous consults also, in which the patient delivers that data to you over an email and you respond in the next 2 or 3 days. That would be for non-emergency consults. Then the purpose of consultation, whether it's a first consult or follow-up consult or an emergency consult. Now, there are a lot of legal issues that are involved with first consult, second consult and emergency consults, and then it is the person to whom the advice is being given. So you can have a super specialist talking to a physician who is delivering care to a patient, or you can have a super specialist talking to a patient directly. That also depends whether it's RMP to patient, RMP to patient, RMP to RMP, or RMP to a healthcare worker.
I would just take a pause, sir. What is your commonest mode? Video, audio, text-based? What do you use in your clinical practice? Because after the COVID-19 pandemic, we are seeing a lot of boom in the telemedicine and teleconsultation. So can you just enlighten us on your practice? Sir?
I guess the video consult is going to be the best that is available. A lot of EMRs are available that have built-in video consultation that basically can track the start and end of the video consultation, that can identify a patient, and the consult, when it starts, the patient can provide consent also that he is ready for a video consult, and there is no legal implication for that. Right. What about your experience? What is your experience?
Personally, I have not used any platforms for consultations because even as we know, I'm not taking the names of any platforms. We know a lot of platforms are available. What in my practice is that most of the time we use WhatsApp WhatsApp video consultation. That is the most common that I have put it into practice. So as said, video consultation basically.
So what about the consent part when you are doing a WhatsApp consult?
Yes, before that, I think consent is of two types. Like the implied consent is there. So most commonly is the patient who is approaching us, the doctors, for the consultation. So they will be putting up some message, or sometimes they will be giving a voice call. So if they are giving a voice call for us to have some evidence, you can ask them to put up a message also in WhatsApp that so and so doctor, we would like to have a consult. So it will be there, and you will have to try to keep that message in the chat box itself. So it will be act as an evidence if any issue occurs later.
So these basically are what the models are. You can have a platform wherein the patient and the doctors are logged in, and the patient can initiate consultation. The most common and probably the most legal thing that you can have. If the patient initiates over messaging app, that is implied consent by the patient that the patient is ready for a consultation, and then you can have inter-doctor consults also. There are various models. What is a first consult, a second consult, and how do you define?
Yeah, this is very important because this has been given in the telepractice guidelines. What are the first consult? First consult is a patient who is consulting the doctor for the first time. And the other part is that the patient who has consulted earlier, say for example, a patient who has consulted the doctor 6 months back, and again after 6 months he is coming for a next teleconsultation, that is also considered as a first consult only. And again, the person who has consulted earlier, say for example, a patient who has had diabetes, he has consulted you, and later some part of screening he has done a TSH, and if the TSH to be higher, he wants a consultation for the thyroid aspect, that will be again considered as a different health condition the patient is consulting. So again, that will also be first consult. So these are the three situations of first consult that you will have to keep it in mind.
So we have to be very careful because a lot of guidelines, suggestions are that first consult, second consult, and emergency consult are different. You can prescribe medications according to whether it's a first consult, second consult, or an emergency consult. Got a lot of regulatory framework, guidelines are available, National Medical Council Act, MCI code, and the Information Technology Act. Will not go into details of this. What about the guidelines that you have to have for telemedicine?
It's very important, this 7 method protocol to have before a teleconsultation. You can see the first point, the telemedicine should be appropriate and sufficient as per the context. So the context is very important because you cannot manage emergencies or any dire emergencies over the teleconsultation. So the context is important. It should not be, mostly it should be a non-emergency based diagnosis or treating condition. Then identification of the registered medical practitioner, the patient is required. Very important. So what we usually use is we get some identification through the WhatsApp. They are some of the ID card or whatever they are having. So we will get it. So we will be having a photo also. That also helps in the identification. Then the mode of telemedicine, the audio, text based, or any video based. So these are the one. Then consent we are going to. That is a implied consent, and there is a explicit consent required also. That will be coming again also. Then the exchange of information for the patient evaluation, that is very important because key factors which you need to reach in a particular diagnosis, that is required. Then the types of consult we are going through, first consult and the follow-up visit. And the patient management, so it can be either a health education, either a counseling, or even an evaluation diagnosis, and even prescribing medicines for the treatment.
So the consent is implied if the patient initiates the consultation, and explicit consent if the healthcare worker, RMP, or a caregiver initiates, for example, in a secondary consult or second consult. It can have in the form of a form, text, video, audio, message. So if you have a platform, patient and the doctor both registered on that platform, the patient can identify the doctor can identify the patient, and you have consent that is implied and explicit both on the platform. What is the matrix because a lot of drugs cannot be prescribed on teleconsultation?
This is very important.
What is the matrix?
Yeah, this is the important bit. You can see the list O group. O, you can remember, is like OTC. That is the usual over-the-counter medications that you can prescribe. So you can see even in any of the mode of consultation, you can prescribe the O drugs category, and any first consult or follow-up consult, you can use it. So O means usually the antipyretics, antitussives like that, paracetamol or etc. Then the A group. Can you just please elaborate on the A group?
A group are basically drugs that are very safe and can be prescribed, and for the medication for chronic disorders like hypertension, diabetes, hypothyroidism, you can prescribe these drugs and the patient can take it after you have given a prescription. What about the B category?
B category is the mode of consultation. So the category of B is usually refilling. That means the patient has been already on, say, antihypertensive, antidiabetics, and so for or even medication for thyroid. So you can refill it up. So refilling can be done in any mode of consultation, like audio, video, or text, and even it can be in the usually the follow-up only. So B category means follow-up medications will be done in the B category.
Then you have the prohibited category, Schedule X, not to be given. No injectable can be given. Insulin cannot be prescribed on telemedicine. You cannot give injection testosterone, GLP-1 receptor agonists, that are the injectable forms, and any other injectable therapy cannot be given. What exactly do you feel there is telemedicine in endocrinology?
So, as far as endocrinology is concerned, the major chunk is always diabetes and thyroid, which is definitely we can use the telemedicine to a good extent in the diabetes and thyroid management. Then the other ones like calcium and metabolism disorders, as part of screening, you can ask them to assay based on the symptom. And obesity and even osteoporosis to some extent, as part of the screening only, not the, so sometimes injectables and anything is required, you cannot prescribe it.
So probably this is the most important slide of our presentation, Tele Diabetology, where you can have observation screening, you can have a retinopathy screen, you can have foot ulcer assessment, you can have photographs, you can have a remote CGM that is in children, wherein the data can be transmitted to your computer or to your mobile device. You can give consultation to the patients. There can be risk calculators, documentation of glucose diaries. A lot of devices now available that can basically transmit data over Bluetooth to the mobile device of the patient, that can transmit data to the doctor. Your CGM protocols, you have continuous subcutaneous insulin infusion protocols, smart pens that tell you that the patient has, for example, taken growth hormone, this dose, this amount, and probably that will come in near future for insulin also. A lot of mobile application and interventions, including bolus calculators. So how do telephone video calls help?
It improves the patient motivation, yes, definitely, because you will be able to continuously monitor the patient and their glucose levels and all. Then therapy adherence, you can check whether the patient is taking the medications correctly, because based on the glucose responses, you can definitely assess, and even the metabolic control. The data can be reviewed, and if any reinforcement is required, definitely that also can be done, especially for the medical nutrition therapy. That is very important. And then you can give hotline numbers, like you have any diabetes educator or any qualified nutritionist with you. Definitely they can again give for any sort of emergencies, to just to inform that all can be done. And then virtual training session, that is very important, because these days we see a lot of programs on the virtual training sessions also, which is very useful.
Now some advancements, you can have mobile application wherein the patient can log in his blood sugar levels, his or her, and that he can see real time over your devices. You have some basal bolus calculators that were being talked about in the previous presentation. CGM recorders and remote CGM new device that can tell you real time data of children with CGM, and you can advise interventions at that time. What about complications? Can it be used in complications of
just
diabetes
before going
also?
that, I will clarify one point, that insulin cannot be initiated with the first consult or with our teleconsult. But if the patient is already on insulin, you can adjust the dosage. So that you can do. So before the next in care of complication is diabetes foot. That is very, very important, because one of the most neglected area is the diabetic foot. So screening. So it's very important, and definitely you can use a teleconsult, and there are lot of papers published on the foot screening also during the COVID pandemic also. Then skin issues caused by the insulin injections or even the CGM systems, definitely you can use it, you can identify, your diabetes educator can identify it. Then technical problem relating to the insulin delivery or even the glucose sensors, yes, we are definitely managing that. In retinopathy, recently there are some even Indian papers now recently published on the artificial intelligence on the retinopathy screening or tele-retinopathy, tele-ophthalmology screening also.
In fact, thermal imaging for diabetic foot ulcers and screening for diabetic foot disease can be utilized, underutilized, because most of the iPhones, if you see, or the Apple devices, they have thermal imaging cameras also in them. So if you can just check that with the thermal imaging camera, you can make out whether you have some inflammation somewhere or you do not have inflammation. As simple as that. So you got a lot of telehealth adoption from endocrinologists. This is a paper from US, and almost adoption was to the tune of 88%, with good reduction in HbA1c and LDL cholesterol, and the quality of life of patients also improved. So why do you think endocrinology probably is the most suited branch for telemedicine?
Yeah. So endocrinology, so mostly, yes, clinical examination is very important, but equally supportive is a biochemical. So the lab workup is very important. So that is one, because most of the time diabetes and follow-up is mainly lab-based after the first examination is over. Or even thyroid also, it's mainly the lab reports that we see. So that's where that's the advantage that we have for the teleconsultation in the endocrinology. Then some of the additional tests can also be because these are all lab-based. Then the data can be reviewed in total. and the patient can be reviewed in person if needed, or else you can, if you are finding anything fault or the lab value is not correlating with the clinical features, definitely you can call them up for the review, and again you can re-examine. And there is more room for complex patients to be reviewed in person also. So it's definitely a good area where a mix-up is always possible.
So chronic patient, stable patient just want a review of reports, you can always tell them to have a teleconsult, and you can have more complex patients in your OPD for workup. Lot of advantages, saves time, monetary benefits, safeguards against infections. Remote areas can also take consults, better health outcomes. Physician saves time, safeguards against infections. There's a semblance of normalcy. The patient knows that there's someone out there who can take care of them, and less care fragmentation. But what all things do you have to be very careful?
Yes, this is very important. Again, the misconduct. So just like the in-person consultation, teleconsultation also misconduct is important. So like the situations like all actions that willfully compromise patient care or privacy and confidentiality or violate any prevailing law, they are explicitly not permissible. Then doctors insisting on telemedicine when the patient is willing to come for a in-person consultation. So that is also like a misconduct. And again, misusing patient images and data, especially many times DSD we encounter. So it's always better to deal that sort of patients with in-person consultation itself. Prescribing drugs from the prohibited list. So that is also a misconduct. And doctors are not permitted to solicit patients on the for telemedicine through any advertisements also.
The second thing that is important is you have to maintain log of your teleconsult interactions, records, report, document, images have to be kept with the RMP, and you have to maintain the prescription records if the patient comes in for an in-person consult. Fee for teleconsultation can be whatever you decide,
Yes.
can be higher, lower, but you should provide an invoice for this.
Definitely.
What about emergency situations and
Yes, as
teleconsult?
said, emergency situations should not be dealt or managed with in the online platforms. But you can definitely guide, say for example, a patient who has been on adrenaline insufficiency diagnosed on steroids. The patient is suddenly found unconscious, and the caregiver is calling you. You can guide them. Yes, you can tell them, yes, it could be probably an adrenaline crisis. You take them to the hospital immediately. But you should not manage it via the online modality. So that is very important. So you can see here, advice, first aid. This definitely can be done. Then counseling, yes, definitely can be done. And even facilitate referral. So these are the model.
So a lot of pitfalls. We've shared a lot of advantages of teleconsultations and telemedicine, but sometimes adequate physical examination may not be possible. Very important, growth pivotal disorders, DSDs. Sometimes you can miss signs because the patient is in artificial lighting. You can miss anemia, jaundice. You cannot examine the patient, and in-person assessment always better than video review. I tell my patients a 3D examination or a 3D image is always better than a 2D image. You can have a breakdown of patient-physician relationship because of these pitfalls, but you do have a lot of barriers, acceptance, lack of knowledge, technical issues, regulatory limitations. And what about the legal aspects of teleconsults?
Yes, legal aspects. So certain areas are not well defined in the telepractice guidelines also. Then the patient privacy and confidentiality is very important. And yes, the data accuracy and the misdiagnosis. So that is also possible. Medical liability. So like in-person consult, definitely the doctor is responsible for the medical aspects and the treatment aspects also. And prescription of controlled substances we have already gone through.
A lot of ethical issues. You have to see who will benefit, whether it's the patient, healthcare provider, stakeholders, reduce mortality, increase quality of life, cost effectiveness, and how do you install and monitor devices. Consent is very, very important. Lot of guidelines for exclusions also, hardware, software not specified, data management system not specified, surgical invasive procedures remotely not specified, research evaluation has not been specified, whether you can do a consult outside India also not specified. So in summary, what do you say about teleconsultation in medicine, especially endocrinology?
Yes, so before summary, I will just add one more point. So in the telepractice guideline, they have mentioned that if there is any leakage of the data, privacy data, leakage of the patient data has happened, the doctor is not vicariously responsible for that. It is not entirely the onus is not on the registered medical practitioner alone. But what they have said is that before choosing any platform, be sure that they are reasonably okay. To summarize, yes, definitely telemedicine is one of the upcoming tool, and there are a lot of benefits we have gone through. May not fit all the doctors and even the patients. Is of course, the most important crux is the doctor-patient relationship, the touch of the doctor with the patient. That is definitely, that cannot be substituted by through any online consultation. I think many of the times, however, how much time you spend in the online consultation, 10 minutes with the patient, still the patient is not that much satisfied like the 2-minute consultation that you have in person in the clinic. And acceptance and technical issues with having a good internet and all is also very important, and that legal and ethical issues also has to be kept in mind. Thank you all for the patient listening. Any questions or queries or any comments?
Thank you, Dr. Prem. Dr. Saket.
Yes, I think you have covered the topic quite comprehensively. There are one or two things I'd like to add. If you think the patient has come to you and you are not the right specialist for the patient, you have to stop their consultation, refund the patient his fee, and refer him to an appropriate specialist. This is your responsibility. If during the consultation patient feels that he is not satisfied with online consultation, even then you have to terminate the consultation and refund the patient his full fees. So these two things also are to be kept in mind.
Yeah.
The point is very well taken, and there was a lot of issues during COVID time regarding the fee problem in Punjab, and there was some issues were there. So what are the legal aspects regarding the
Nothing has been mentioned on how much you can
charge?
Yes. That is, they have left it up to the registered medical practitioner depending on
No
their
upper limit, nothing like that.
Yes, nothing, no capping or nothing has been kept.
And any
has been
time
mentioned.
limit for one consultation?
Nothing, no,
Nothing.
that is
it
also
can
not
go for
mentioned.
hours or it can be 5 minutes.
Yes. No mention on that.
No mention.
Yes.
In fact, if you look at many doctors who take lesser charges on online consult because they do not have to interact with the patient, and there are many doctors like neurologists, they charge a lot more for online consults compared to in-person consult, because, and orthopedicians also, because that would take away the physical examination that they have to compensate for the physical examination on an online consult. So that takes a lot of time. So fees, I guess, not in the guidelines.
It's an individualized thing.
Individualized.
Individualized.
So I thanks Dr. Prem Narayan, Dr. Saket Kant for their
One query.
Yeah.
No, that you can, that what they mentioned is that the fee which you have taken can be applicable as like an in-person consult. Say for example, if you are in-person consultation, you are charging it for a 7 days period, and after this on the 8th day, the patient has to pay it. Again, if he is reconsulting, the same thing can be applicable for the teleconsult also.
In fact, for these type of queries, probably the apps are a very good option, because you can set the fees, you can set the number of days that the patient can consult again in that app itself. So whenever the patient, for example, if you set it as 3 days that you can consult, the patient tries to book a consult with you within 3 days, that would be free of cost. That is a review within 3 days, and that day amount you can set. You can set 3 days or 7 days, that is on you, and there is no legal issue on that. After 3 days, probably if the patient tries to book a consultation, the patient would have to make a payment to make a consultation. So there is both consent, there is full legality, and you can have a very clear-cut direction in the app about the fees and the number of days the first consult is valid for.
I got it. But suppose the patient consults you directly without any app. So the patient consults you online by WhatsApp or some other means.
That you can mention. That you can tell them, no, before, when they are asking for a consultation with you. Say for example, they have put a WhatsApp message as, "Doctor, I would like to have a consultation. So what is your consultation fee?" If they are asking, or if before asking, you can tell them, say for example, this much rupees, and it is valid for 7 days, or if you are giving one more extra consultation in the 7 days, one more extra consultation. That you can tell them. That you will have to tell them. If you are not using any platform.
So better use some apps, standardized apps or some verified apps that, as Dr. Saket has said, it would be good for, because consenting is done, everything is legalized.
All apps were down during COVID. All apps were down during COVID. So patient used to call.
Yes,
No, that's true. That's true. COVID is an exceptional thing. That it's an upcoming thing now. Probably for those who are living in remote areas, it would be a good thing.
Definitely. So I mean, just you can. I mean, I'm not using any platform. Basically, I'm using using the WhatsApp modality only.
I'm also not using any platform.
Yeah. So you can just mention my staff will mention that this much is a consultation fee, and it is valid for 15 days, or one more extra consult in between the 15 days. Bas.
Thank you.
That you can mention it.
That's legally valid.
Yeah,
Yes,
Dr. Saket said that.
Copy of prescription, yes. That what we usually, what I do is that I put it up in the EMR, we have the EMR and we mention it and the prescription will be printed and with the seal we'll be sending the WhatsApp message.
So with that, I end this session of the last session of the SPEEDCon. Thank you very much.
Thank you all.